London Bridge Sports Medicine Podcast. Hello and welcome to the LBSM podcast. Today I have a return guest, a physiotherapist, Julie Backley, who is a respiratory physio from the Institute of Sport, Exercise and Health. We've previously had an episode discussing breathing patterns, and today we're going to be talking about breathing under pressure. So a little bit more about anxiety, competition and performance and how breathing can affect that.
Thank you. It's great to come back and talk more about breathing. As you'll probably gather, I'm very passionate about breathing well. I'm a respiratory physiotherapist and I work up at the Institute of Sport, Exercise and Health, where we help athletes to improve the way that they breathe. And so it's about breathing efficiency alongside many other things like getting accurate diagnosis of asthma or exercise-induced lungal obstruction, which is also another common respiratory issue that athletes often experience.
Okay, so let's get started. I can imagine most athletes have felt it at some point. Standing on the start line, their heart racing, their breathing starts to quicken, and then sort of suddenly they feel like, I'm not going to be able to get enough air. I can't do this. I can't breathe. They haven't got that rhythm. And so let's sort of start with what's actually happening with our breath when you feel under pressure like that.
Yeah. Horrible sensation. So, maybe we need to strip back sort of breathing physiology a little bit and also delve into the sympathetic nervous system and the power of that nervous system, which is incredibly important. We always, when we want to perform our best, we want that nervous system, which is your active and alert system, to be really on our side and working well. Your breathing is usually controlled, it is controlled by your respiratory centre, but it's heavily influenced by both your internal physiology but also your environment. So exactly what you just described, the excitement, the fear, whatever emotion it is of the performance that's imminent. And so that sympathetic nervous system is very much activated and your breathing can feel faster. It does get faster. Your heart rate gets faster. Everything's sort of pumping, isn't it? And getting you ready,
yeah.
Which is brilliant. As we said, that can really mean an amazing performance. But sometimes it can just overflow a little bit if there's just a little bit too much. And if those thoughts come in, like you described, of more worrying thoughts, more questioning thoughts, that can often lead to even faster breathing, which may be then detrimental for performance.
Okay, so you sort of, like you were saying, it's sort of, there's normal pre-race nerves and you have that sort of pre-race adrenaline, but then it can sort of tip into something that can then limit the performance. So that sort of fight or flight response, I guess, can then sort of...
Your body's continually trying to keep you in a homeostatic state, a balanced state, both the internal physiology to try and enable you. And then, you can imagine the gun goes or whatever it is that goes off, the race or starts. And there's this sudden, increase in demand for the body. So you want your body to be able to respond to that. And often, exactly, too much might mean the body is thrown out of balance. And that's when it can't function properly.
Yeah, okay. And so what are the common breathing patterns that you see in anxious or high-pressure sort of performance athletes?
Lots of excessive sighing, big deep breaths. A couple's okay, but again, you start to do excessive sighing and deep breathing too early, hours before you're about to perform. So that lead up to that performance is going to be really important, isn't it? We always talk about familiarity and routines and don't change anything before you perform. Being able to feel very comfortable in the lead up can often help those sort of pre-race nerves. So you're looking for we don't really want the breathing to get too fast and too big too soon.
You've talked a little bit about the physiology of over-breathing, but go into a little bit more detail for us about the sort of physiology side of breathing.
Yeah. So if you breathe too much, too fast, too soon, a number of things can happen. One, the respiratory muscles will fatigue potentially earlier. Your respiratory muscles are they're very important during high intensity exercise obviously, but they're also the most important part in that if your respiratory muscles are starting to fatigue during a high intensity bout of exercise, the blood will be diverted from, say, for example, your thigh muscles, say you're cycling and or whichever sport it is, your peripheral muscles that are incredibly important be diverted up to the respiratory muscles. So the respiratory muscles can often trump your lower limb muscles. So they get more blood supply because they're higher demanding, they're starting to fatigue, they need more oxygen, they need more energy, which leads to a decline in your ability to sustain the intensity of your performance. So your watts might come down. And that's often what we see with that overcooked breathing pattern where the accessory respiratory muscles are working too hard, too soon, they're starting to fatigue. And that not only feels breathless and uncomfortable, it also can impact on the speed or the performance from a fatiguing point of view too.
Okay. And presumably it also has effects on things like feeling dizzy and tight chest and that sort of thing. Are those things that maybe some athletes describe?
Yeah, and that might be due to them breathing in excess of their metabolic requirements. So what we mean by that is basically it's the too fast bit. So if they're breathing too fast, then they're going to potentially have problems with dropping their CO2 levels, which causes peripheral vasoconstriction, which again means less blood flow to the peripheral muscles. It potentially means less blood flow to the brain. So like you said, that dizziness or that inability to make very quick decisions, that concentration can go. It creates anxiety, which then obviously creates worrying thoughts, doubting thoughts. Not a time to be doubting yourself when you're trying to perform and push your body really hard. And, we rely on those thoughts a lot of the time to help us in those, that high intensity exercise. And if they're not helping, then, they can be a reinforcing, driving the breathing to be even faster. And before you know it, you're stuck in a horrible, vicious cycle of a place that's not very comfortable.
I can imagine. And it's really not where athletes want to be when they're just about to embark on an important event. With regards to obviously pre-race nerves and this dysfunctional breathing, how can athletes sort of try and interpret that and recognise what is normal for them and maybe what's escalating and how they can maybe kind of mitigate that?
Well, having a breathing awareness of what optimal breathing should be is really important. I think we go through life often just taking it for granted that we all breathe the best we should because our body just knows best.
Does it anyway, yeah.
No, right? But actually, the breathing is very adaptable. It's very changeable. Now, that could work in your favour or not. But, when you can make it work in your favour, then you can use the breath to actually help with this management of this sympathetic nervous system. Of maybe when you don't want it to get too quick, too high, too soon. And we can use the breath work to down-regulate a little bit. So that might be that we just slow the breathing down a little bit, make it more diaphragmatic or take longer on the out-breath. There are techniques that you can do. But coming back to that awareness of that optimal breathing pattern is really the first step, whether that's at rest, whether it's when you exercise. Along with that is understanding is your body is very good at becoming, the breathing is very good at responding to the stress, and we want it to. My point is that it's very normal for your breathing to get faster and a bit higher in a time of stress. So I don't want people to think that shouldn't happen.
Yeah.
That's important. It's the ability for the breath to then come back down again afterwards, maybe, or it's what I call breathing flexibility. You have a breathing pattern that's able to rise to the occasion, not too fast, too quick, too soon, too big, too fast, too soon.
Yeah.
Meet what your body needs to do in that moment. So it might come a bit higher up in the chest. It might become a little bit faster. Well, it will become faster. But then afterwards, does it come back down again? Does it come back down where it needs to be to that nice, nasal, relaxed, slow, small, quiet breathing? And so often when you have athletes that maybe have got a heat in the morning and a final in the evening, that middle part of the day can be really crucial at allow the breath to come up and perform that performance, but can you bring it back down again to get a couple of hours recovery?
Yeah, I can see that. Yeah. And so obviously you talked a little bit briefly on some strategies that athletes can use. Can you go into a little bit more detail on perhaps something more actionable for them in terms of before competition and then perhaps during competition, and then, as you were saying, after competition, what they should be doing?
Yeah. So I mentioned there about having a breathing awareness of what good optimal breathing is. And if anyone's unsure of that, there's a website called the Physiotherapy for Breathing Pattern Disorders website that I recommend. People want to just watch videos of what optimal breathing is at rest. There's also a self-assessment there. That's usually a good starting point. That's just your bread and butter basic breathing. So I 100% recommend that's really important to do. And then if we come then back to pre-race, lots of things stimulate you to breathe faster too soon. So understanding maybe what your triggers are. So say, for example, you're in a very warm country, it's very humid. The weather, the environment, pollution, they might potentially, you can imagine, allergies is one that just came to my mind there. Certain being exposed to certain things in the environment can stimulate the way you breathe. So even just having an understanding of what might make you specifically breathe a bit faster, a bit deeper, and how you might mitigate that in terms of thinking about the leading up to the race where nerves are going to come in. We want them to come in, but we don't want too much. So depending on how, the few hours before, it's about maybe just keeping your mouth closed. I know that seems really simple, but, when we are stressed, the mouth does just drop open and the breath gets a bit bigger without us even realising. So very simply being able to close the mouth and just think about more of a diaphragmatic breathing pattern. So allowing the shoulders to drop, just thinking about that lower rib cage. So you can sort of, thinking about breathing out to the sides a little bit more around that higher waist area, that lower rib cage area. Just sort of slowing the breathing down. So it's the awareness and just being able to, without trying too hard.
Okay.
Your respiratory center doesn't mind changing things a little bit, but if we try too hard, if we ask it to do too much, it can sometimes just respond with a no, thank you very much, I'm going to take big deep breaths into the top of my chest. So my point is be kind and nurture that breathing center with possibly just a couple of breaths. Or in some cases, sometimes athletes, you just don't even say the word breathing, because even if we say the word breathing, that can sometimes make you want to breathe more, right? So
it makes you very focused on it.
Maybe it's looking at techniques where you are just listening to your favourite song, or you're doing a relaxation, or you just bring yourself into the moment and look at the colours around you, or anything that might also down-regulate you a little bit. Doesn't always have to be through the breath, right? So let's just throw that out there as an alternative.
That's good, actually, because like you say, it's sort of, if you suddenly get someone to really focus on their breathing, it can all get a bit intense. It's like when you're trying to get somebody to think about their running technique, and then actually sometimes you just have to go, just don't think about it, because you're thinking about it too much.
People try too hard, and you can imagine athletes, there's such, everything gets tried too hard, and it's like, okay, let's try not so much.
And then, so that's sort of before the competition. So, I mean, that sounds like a really good plan, listening to music, maybe just trying to breathe through the nose. I know you've talked about that in our last episode, was how important nose breathing can be, and lengthening that exhale slightly. So those are some really nice tips before a competition, just to get them into the right headspace. And then what about during the competition? Because obviously this is the point where the body is really, it's pumped up and it's doing its thing. But if an athlete is sort of starting to feel, I can't catch my breath, what sort of things can they do to sort of try and regain that control mid-event?
And I think it's an important point, isn't it? It's to control or not control. And is your body going to respond to control? Because we've talked about having a rhythmic breathing pattern is much more reassuring for the body than an
Yeah.
erratic breathing pattern. So if we talk about tuning into the breath, then that can, in some cases, be very helpful. Like we said, trying to slow it down, focusing on the out breath. I've said it before, but I'll say it again. Often in a heightened, anxious place, our brain will probably want us to breathe in. It's going to focus on the breath in. And I would say to people, really focus on that breath out, just lengthen that out breath. That would be the first thing if you're tuning into your breathing. You could also potentially think about some entrainment with the breathing. And what I mean by that is, if you are running, that might be some cadence breathing where you are trying to get some rhythm with your steps. How many steps and how many breaths you take on the in and the out will be very dependent on your breathing rate and your cadence. So it might be in for 3, out for 4. You know what? Actually, what I would do is just see what feels most comfortable. And if they can get their breathing to feel a little bit more comfortable and a bit more rhythmical, then often that can really help calm that respiratory centre and feel a bit safer with what they're doing.
Okay. And then if you were going to give people a bit more sort of advice on the post, because I know you've talked like that is actually quite key, is the post exercise, being able to regulate or sort of down regulate your breathing after an event.
Yeah. It's similar to the pre, because it comes back to you having the ability to breathe well on what you're breathing to match what you are currently doing. So if you are coming down off the back of a training session or a hard race, you want your body to recover as quickly as possible. Yeah. So we want that breath to match what the body's doing. So what we don't want is that heightened upper rib cage, faster mouth breath to be happening during recovery. We want that nose, quiet, belly, slower breath to be happening, that will enable the body to balance out and really be able to supply those muscles with the blood that they need, all the sort of physiological benefits of a more parasympathetic nervous system state. That's when we go into our rest and our recovery. So using your breath to be able to do that through that slower nasal breathing can be really helpful. And in the science tells us over the thousands and thousands of years to really get your parasympathetic nervous system activated is you drop your breathing down to 6 breaths per minute. Now that's quite a lot slower than normal breathing rate, right? So our normal breathing rate might be 10 to 12 if you were just sat still watching TV, but we're talking about almost half that. 6 breaths per minute. Now that's not something I would get someone to jump into if their resting breathing rate is up at 16, 17, 18 breaths per minute. You probably want to work on getting it down to 10 to 12 first of all. Yeah. So I'm always a bit like, look, breathing's got to feel comfortable. When you practice it, make it feel comfortable, because I'm not sure that parasympathetic nervous system's going to come in if it doesn't feel comfortable. So, there's a sense of a relaxed body there. Yeah, and bringing it down. That can be a really nice way of promoting a more relaxed state. A more relaxed state will increase your heart rate variability, which will increase your recovery and your ability to go again when you want to.
Okay, that's really helpful. Some good tips. Now, one of the things that I want to kind of cover a little bit is when it all goes a bit horribly wrong. People, you can notice that things aren't great and you can sort of try and mitigate some of that. But what if things go really wrong and you sort of have this panic breathing where there's sort of, really erratic breathing, visible distress, and, your pacing is suddenly all off and things are going downhill?
Yeah. Well, we sort of talked about, to tune in or tune out. And there is this one option that it might be better to tune out of the sensation of breathing at this stage. I'll give you two alternatives here. One of them is to tune out. We'll talk about that first. Where actually you might want to just bring, depending on if it's safe to do so, depending on what sport you're doing, is you bring your head up and you have a very wide eye gaze. So widen out your peripheral vision and just literally widening, metaphorically, your body stance.
Yeah.
And we think that there's some evidence to tell us that widening your gaze can help downregulate the sympathetic nervous system, along with looking at what peripherally might be on the horizon, or, bringing that element of being in the moment, looking at colours, looking at shapes. looking at different people running around you, bringing yourself outside of your physiological experience can potentially help. Dropping the shoulders, widening the lower rib cage. We'll talk about smiling. Smiling widens everything. It can change your emotional
psyche.
State too, right? It's important. So there's that element. Now, not everything works for everyone, right? So we might find that actually some actual tuning in and taking control to an extreme level. Now, I'm never usually one to talk about box breathing, okay? Because it sometimes drives me a little nuts when people are using it in everyday life and it's nothing normal about. No one breathes in boxes in squares. No. However, if we want to help this respiratory centre that's in an absolute state and is firing off left, right and centre, actually, if it helps someone in that scenario to breathe in, if you're following the shape of a box, you might be in for 2, hold for 2, out for 2,
out for 2,
hold for 2. Do you see what I mean? And imagine 2, 4, 6, 8, we're now slowing the breath down, quite significantly. And that box sizes might be 1, 1 and 1. It might not be 2 seconds, depending on how they're. Now, if that gives a sense of rhythm to a respiratory centre and it works, then 100% I'd be thinking about using that technique to help someone in that scenario.
Yeah, I find that I do that sometimes. I mean, if I'm doing a sort of slightly longer run, partly slightly out of boredom, but also if I am just sort of finding it a bit hard towards that sort of the sort of third of the run, I do feel like I quite often count, like I'll count 2 breaths in and then sort of 3 breaths out. I don't know if that is something that is a good thing to do or not, but I do think for me, it does help to sort of focus and get me through the next sort of bit. There's a bit of diversion. Yeah.
Possibly.
Although but then I guess some of it's diversion, but then some of it is actually focusing on something, focusing on your breath.
Yeah. Although I've seen athletes where they've come to me with that pattern and I've had to help them undo it because it's not levels. Good. And it's like, and then the third level is one where they come into the neck and the shoulders, and I'm like, there's really not much lung up there. That third breath in isn't helping because the chest needs to open as one. So the diaphragm contracts down, so the lungs get longer, wider, and then this comes here. If you start breathing in compartments, then it could lead to an asynchronous breathing pattern. Now, listen, if something works for someone, well, who are we to change it, right? We see all sorts of
weird and wonderful things. Yeah.
You know what? So there is that element of, listen, if that's working for you, go for it. But at the same time, if it's trying to fix a breathing that's not working and you're trying to do it, then maybe that's the alarm bell. So if it doesn't feel quite right, it's not working.
Don't do it. Yeah, absolutely. Well, it's been really interesting talking to you again. And let's just do a few kind of closing takeaways for our listeners to get an idea of. So I'm going to just give you a few questions and then hopefully we can just recap on some of the stuff that we've been talking about. So what would you say is the biggest breathing cue under pressure?
Breathe out.
Breathe out. Okay. Yeah. Thinking about the breath out.
About the breath out. Because your mind will be telling you other things. It'll want you to breathe in, and the chances are there's probably more air to come out, and there'll be more space to breathe in.
Okay, that's a good one. That's a good one. And what would you say are some of the biggest mistakes that an athlete makes in terms of their breathing?
I want to come back to that term, that having a flexible breathing pattern. We talk about doing our, strengthening and our stretching, and actually we also want a rib cage where there's alongside it 20 odd muscles that work to open up that rib cage, and then you've got your brain that also wants to get the respiratory center and the emotional center and your cognitive part of your brain. You want everything. You want that brain and that rib cage and all those muscles to be able to respond to whatever you ask it to do. So having a flexible breathing pattern that can breathe efficiently at rest while you're sitting at your desk working with your mouth closed, diaphragm, no upper rib cage, to high intensity exercise where it's able to open and close that rib cage beautifully in the best possible way that it can, to when you are really relaxed and you're trying to recover, where you can do some really lovely, slow diaphragmatic breathing that's going to help your body recover. That, to me, is the epitome of having an efficient and good flexible breathing pattern.
Okay, Very good. And then one thing that people should practice on a regular basis, we can say weekly, but yeah.
Can I say 2?
Yeah, go for it.
So the 2 would be, when you sit and watching TV, close your mouth, allow your belly to rise and fall. Should be a nice pause after the end of the out breath, and it should be very small and minimal.
Yeah.
That's my first one. My second one is, when you clean your teeth, watch yourself in the mirror, taking a big deep breath in. And if you take a big deep breath in and you see your shoulders rise up like this, drop them down, put your hands on the bottom of your rib cage and have another go and feel your hands coming out.
Expanding out.
Yes, and in again.
Okay.
And just that is normal breathing when you take a big deep breath.
Okay, excellent. And can you just go back to giving us the information on assessing your own breathing pattern? Because you mentioned there was a good website to go to.
Yeah, and it is focused more at rest, but I always say that's a good starting point. So the physiotherapy for breathing pattern disorders. So it'll actually be physiotherapy for bpd.org.uk. And if you go to the resources page, you can watch some videos of what optimal breathing is like at rest. And soon to come is one with movement as well. So watch that space.
Great. Well, that's really helpful. And it's been, as I say, it's been great talking to you again. So thank you very much for your time. And hopefully we'll get you on again for some more episodes.
Lovely. Thank you very much indeed.
All right. Take care, Julie.
Bye-bye.
Bye.
Thank you for listening to LBSM's Ask the Expert series. We really hope you enjoyed listening. If any of the topics discussed are relevant to you or you want to find out more, please get in touch by phone, email, social media, or visit our website. Thanks again and see you soon.